Hello, this is Brian Casey of the Imaging Wire. We are here at RSNA 2024, and we are here in the booth of PocketHealth with Rishi Nayyar. He is co-founder and CEO of PocketHealth. Rishi, thanks for being with us today.
Brian, thanks for making the time.
You bet. So can you tell us a little bit about PocketHealth and what you guys do?
Definitely. PocketHealth is a connected care company. We are focused on using cloud technology, patient engagement, and image exchange to fill all of the gaps in the care journey.
Awesome. Now, we're here at RSNA in Chicago. It's kind of the radiology's Super Bowl. What are you guys highlighting here at the meeting?
Really, we're talking about how care coordination really encompasses a lot more than what it has historically. So we've taken that concept and expanded and reorganized our product suite into two key solutions. One is Enterprise Image Exchange, and the other one is PocketHealth Patient Connect. And we're spending the show talking about how the intersection of patient engagement and image exchange leads to a much more holistic, carefully coordinated experience that makes life a lot better for patients and providers.
Yeah. So what you guys are doing is you're addressing that problem that has been so persistent in radiology of literally putting patient images on CDs and giving it to them.
And that was definitely the start. But we've expanded from there into, one, a completely robust image exchange platform. That means being able to share effortlessly between providers, even if they're on different networks. And we know that's been an issue in image exchange in the past, sending from AT&T to AT&T, but not AT&T to Verizon, for example. But then also thinking about how can we use image exchange as the springboard to bring patients more involved in their care. So not just give them the images and the reports, but what do they mean? How do I understand the results? Was there a follow-up in there? What do I do next? How does the clerical staff know that that follow-up existed as well? So there's a lot that we've done to really make this all holistic and into one cohesive platform.
Yeah. Now, how's your technology evolved over the past year?
From the image exchange side, we've really invested into community gateways, so being able to improve that network to network or PocketHealth to PocketHealth sharing. And we also launched an entirely new experience for referring physicians who are more strapped than ever, more burned out than ever, and we built a very effortless way for them to be able to access their patients' imaging records very quickly. And then on the patient side, we developed a lot of very exciting patient engagement tools, being able to integrate directly into Cerner, the Epic MyChart, and being able to detect the follow-ups that we built into a completely new platform called Follow-Up Navigator, which is using our AI technology to effortlessly detect the implicit follow-ups, the explicit follow-ups using guidelines like BI-RADS, Fleischner, put into a list, message the patient, tell them about it, message the physician, and make sure that no one's falling through the gaps.
Yeah. And that's some of what you're highlighting here at RSNA?
Definitely. I think we have people coming to the booth saying, look, we're using you for image exchange now. It solved our problem. We're not burning CDs anymore. But patients are still falling through the cracks. There's a continuity issue before. Are they showing up to their appointment? So that they use our solutions like appointment reminders then afterwards? Or what do we do to help the patient understand what's happening, and how do they actually follow up with these incidental follow-up recommendations afterwards? So we've spent a lot of time in this show educating clients and future clients about how image exchange, how we move much beyond image exchange today.
What inspired you guys to focus on patient engagement? It seems like it's kind of a no-brainer, but it seems like it's been sort of under-recognized in radiology.
Our belief is that the reason it was under-recognized is because before we were just sharing raw data with patients. Here's a DICOM image and here's a report. And then we were wondering why are patients not getting more involved in their care? Why aren't they sharing the records with their physician? Why do I still have to do that sharing? We found that as we slowly started explaining to patients more and more and more about what the records mean, highlighting the follow-ups, good things started happening. They stopped asking for CDs, the referring physician appointments got more effective, they started sharing records with their referring physicians, capture rates on these incidental follow-up recommendations went up, so a lot of good things happen when you do engage with patients.
Yeah. And follow-ups is a huge issue in radiology. Patients getting scans and they get recommended for follow-up, and then a lot of times that doesn't happen, and the follow-up rates, the lack of follow-up rates are really high. Can you talk about Follow-Up Navigator and how that kind of attacks that problem?
Yeah, it starts from this basic stunning stat that 60% of recommended follow-ups are not followed up on. So that's extremely high, and stuck in there are some very important critical follow-up recommendations. So what we did is we have this model that we built, a Pocket Health AI model that has been running on the patient side for nearly 2 years. We've generated over 800,000 follow-up recommendations on the model. And we took that, we brought it in locally, client side. Now all of the radiology reports can be run through that, put into a work list. We paired that with our patient messaging functionality, which we've had for nearly 2 years now. And now we can effortlessly understand the different types of follow-ups, message patients effectively, message physicians effectively, and most importantly, in a completely autonomous way. So it's not like you have the nurse navigator moving from typically calling a patient to a Pocket Health interface. They're just focusing on escalated cases and ones where it requires a bit more of a human touch.
Yeah, cool. Now, you guys recently raised a Series B. And can you talk about that a little bit, what you're going to do with those funds, and then how that's going to power you guys in 2025?
Definitely. We raised one of the largest Series B rounds in healthcare this year, a $33 million Series B round. And we largely used that for R&D, R&D, R&D. So nearly all of the capital went towards us growing our R&D team, that's product and engineering, improving our support resources as our scale has grown to, we're coming up on nearly 1,000 imaging centers and hospitals that we're integrated with. And we've spent a lot of time, one, fortifying our existing platform, but two, coming out with really exciting technology like Follow-Up Navigator. We've really increased the team. We brought on Dr. Ram Chadlavada as our new fractional chief medical officer. There's a lot of exciting AI tools that we've been presenting, like our first of its kind medical segmentation model that's live in Pocket Health, helping patients understand this is their liver and what they're looking at when they look at their images. So that's really novel in the industry, very cutting edge AI that we're doing for the first time at scale. So we put a lot of the resources into building better product and better support.
Cool. And where can people find out more about Pocket Health?
PocketHealth.com, or you can reach out to me anytime at rishi@pocket.health.
All right. Very good. Rishi Nayyar, thanks so much for being with us.
Thanks, Brian.
Signing off for the Imaging Wire at RSNA 2024, my name is Brian Casey.